All right, so good evening, everyone. We'll be continuing quickly from where we stopped last time. And today we're looking at problems facing health promotion in developing countries. Last week we looked at some of the declarations as far as health promotion is concerned through conventions like that. We looked at the Ottawa Charter, that of Canada and other countries. So, what are the major problems facing health promotions in developing countries? One of the major problems facing the world or the developing country, as we know, as regarding health promotion, is poverty. So, most countries are undernourished. They have issues with having to feed because of the level of poverty within the country. You can see this is actually most noticeable in African country or Africa as a continent, part of South America, and of course part of the Asian country. So most persons have issues. Most countries are facing poverty, and the consequence of this poverty is that the people living in that country, they have a very poor, they live in a very poor condition. So they don't even feed well. There's issue with poor housing. People live and you face me, I face you. You see 20 persons sharing toilet amenities and stuff like that. So it's actually a very big problem as far as health issues is concerned or health promotion is concerned. One of the major problems. So poverty is one of the major issues facing the world. So because of this level of poverty or these the people living in such countries feed poorly, nutrition very, very poor, even environmental degradation. The condition you find people does not help in promoting um, their health. So that's one of the major problems facing the world as far as health promotion is concerned. All right. Number two, so how do we solve this problem, this issue of poverty? Decision makers, we're talking about the government, World Health Organization, and every other regulatory authority as far as promotion of health is concerned, will have to begin to draw resources from the communities and individuals to meet the health challenges that they face. So we identify, that's why sometimes you see that World Health Organization, UNICEF, and the rest of them, they send relief materials in form of food, aid, medicines, stuff like that, just to help some of these countries that are impoverished. So it's part of a decision that policymakers will have to make to see how we can begin to improve the health of people living in such community. And then how to also direct health expenditures either for prevention or for culture. That means there's need to draw out a budget for some of these areas or countries or regions where poverty is actually on the high side. Expenditure in trying to promote their health, providing basic health amenities like hospitals and things that will just improve their health. So that's one of the major decisions that policymakers will have to make as far as reducing poverty, not to increase or improve the health of the people living in such an area. All right. So that's one of the major health problems, poverty. Then the next one is economic priorities. You know that now most governments are now paying attention to how their countries are seen in, outside their country, like in the world, and they keep coming up with economic policies that would see them compete with other nations, other nations that are well established. So in prioritizing economy in order to stand out among the among the ruling nations and the rest of them, they pay less attention to the plight of the citizens. So they are concerned with how many, like in Nigeria, for example, how many barrels of oil can be exported in a day. And the economic policies just to make them stand out among the rest of the world. But how the citizens are faring, it becomes a very major problem. So that if government don't prioritize the health and safety of their citizens, you see that their health will be affected. So that's also another major challenge facing underdeveloped or developing countries. They want to match with other developed countries, so they pay more attention to putting the country in the global stage and neglecting the citizens as far as their health is concerned. All right, so that's also another problem facing health promotion in a country. So there's a need for government to, as much as yes, they need to reposition the country in the global stage, attention should also be paid to the citizen as far as the health and safety is concerned. Number 3 factor or problem facing developing countries, education. So low level of illiteracy, specifically health literacy, provide another challenge for the health promotion approach. Somebody in the village doesn't understand what it means to take some practices, health practices, or practices that will promote their health, like regular exercise, checking of your vitals, and the rest of them. Thank God for the social media and the media houses that actually helped during COVID-19 to pass the information of how to reduce the spread of COVID-19 by constantly educating people on the need to use hand sanitizers, use face masks, and the rest of them. Why was there a lot of campaign in the media? Even some local communities were going around using town crying method and the rest to just let people know, because they understand that in developing countries or underdeveloped world, the level of literacy is quite very low. So they may not know the things that they have to do to promote their health. So somebody who is not educated will just continue living in ignorance. In Africa, you hear things like, sorry to use this word, dirty no they kill African man. Where is all these things coming from? That means what that means is that death doesn't kill an African man. Our great grandfathers can fetch water from the mud and drink and nothing happens to them. So they believe in all those kind of things from their great grandfather, and all of these things keeps affecting. They do some kind of practices that does not promote their health, and they don't know because of their low level of literacy. So that's also another problem facing underdeveloped and developing countries as far as health promotion is concerned. So countries need to do a whole lot as far as education is concerned. And that factor also facing health promotion or challenges the political instability. Where there is war, people don't pay attention to health anymore. People don't even talk about promoting health. No one will talk about health promotion. It's about the things you do that improves and maintain your health. So when you are jostling for survival, at that time you don't even talk about practices that can promote your health. So where there is political instability within a country, it's bound to affect the health of the people. Imagine, God forbid, now after the election, and there was a serious crisis between the political parties. That at least Nigeria is going to the level where we understand the consequences of rioting and the rest of them. So imagine what would have happened. Look at what has happened between Israel and Gaza. Right now, people living in that Gaza Strip or that Gaza region, would they be talking about measures to improve their health or to promote their health? No, it's now a survival basically. So that's also another factor facing or challenge facing health promotion. So where there is political instability, nobody pays attention to health of the people. And you find all these political instabilities in developing countries. It's not in the US and other developed countries. It's very, very difficult for you to see it. But you basically find all of this. Look at what happened in Guinea-Bissau. Look at the one that happened in Chad. where military comes, take over like that, and subject the people under a military authority against their will and stuff like that. So you basically find out these political instabilities in developing or underdeveloped world. All right. Then we have also intersectoral cooperation, decision makers in all sectors, whether you're in the health or you're in agricultural sector or in commerce or education or any aspect. Everybody must come together if the health of the citizens must be promoted. Focus should basically be on policies that will improve the health of the citizens, and not just policies by book. It has to be policies that would actually, that is practicable, that is well understood, that people can relate with and understand the importance of actually carrying out the things that is in the policy. So that is what decision makers needs to do, and it covers all aspects, all sectors as far as health promotion is concerned. So there must be an intersectoral cooperation. Then another factor or challenge facing health promotion is commercial interests. In marketing, for example, or in business, the businessman is not interested. What the businessman is interested is how much profit he's going to make from his goods or service. So when he's telling you about his product, why you should consume his product, he will never tell you the negative part of the product. He will only tell you, imagine somebody who is selling cigarettes or tobacco. Will he tell you that when you buy this cigarette and you keep taking it, it can damage your heart and your lungs and your liver and the rest of them? He wouldn't tell you. Although, recently now, there's been this, what they call it, how do I explain now? They've been mandated that as much as possible, let people know about the consequence of our abusing it. That's why I see that they will always tell you smokers are liable to die young or something like this. Usually an inscription after the advert or they try to give you a caution or warning when you are consuming such stores. So what I'm trying to say is that the marketers or people who sell some of these products and everything, they hardly tell you the health challenges of a particular product. Coke is, in fact, the most consumed brand in the world. They only tell you what Coke does, how it can quench your taste and just brings you the satisfaction. But they never tell you that excessive consumption of it can actually aggravate your sugar level. Based on, they will never tell you how many cubes there is in one Coke. So you see, it's also another issue that is being faced in developing countries. So the commercial interest has not really helped in actually promoting the health of people, because they are basically interested in just promoting their businesses, and so that becomes a problem. Now, the double burden of disease, you find this in also in developing countries and underdeveloped countries. And what's the double burden of disease? We're talking about both the non-communicable and the communicable disease. For the communicable disease, it is easier to deal with it, or it is easier for us to understand that there's an outbreak of a pandemic or an endemic. Why? Because it's communicable. So by the time 1, 2, 3, 4 persons are suffering from the same thing, then that means there's a trend, there's something going on. So people begin to pay attention. Why is it that the same thing that killed Mr. A killed Mr. B, C, D, and E? So you see people begin to now have interest, and then to find the causative factor, the things that led to it, how can they diagnose it, and how can they prevent the rest of them. But it's worse when it's non-communicable. So you see people living with that burden, that disease burden, for a very long period of time. They may not even know that they have it. Somebody can have HIV and would not even know. And just like we said, the low level of literacy and ignorance, he doesn't see the need of every 3 months or every 6 months run a blood test just to check your vitals and check your system and the rest of them. He carries it until it develops into an AIDS. You understand? So it is worse with the non-communicable. So somebody can live with a disease for a very long time without having to know that he or she has that disease. So it becomes a burden on the nation, preventing the non-communicable diseases and also the ones that are communicable. All right. There are some countries where they mandate it at least. Anytime you go to a hospital, once you complain about headache, it's not like Nigeria where you go walk into a pharmacy and say, please, I'm having headache. The person gives you paracetamol. Countries like UK, if you have a headache, you have to call your doctor. You have to call your medical advisor, who will now invite you to come see him. And then when you come, you lay your complaint. He has to ask you to run a test before he can prescribe. So you cannot just walk into a pharmacy and say, give me paracetamol. So by you complaining and you run a test, they're already helping you to promote your health, to find out what issues you're having. Or here in underdeveloped and developing countries, you can walk in and even buy a wrong drug that is not even for that. So that's a double burden we're talking about. All right. Then we have what we call the speed of change. The surge in population of developing and underdeveloped countries becoming too high. If the rate at which there's a rise in population is gradual, it's easy for the country to deal with the health issues that comes with it. But in a situation where the surge in population is very fast, it's rapid, it becomes a problem. Housing becomes a problem. Food becomes a problem, because the surging population will have to so they have to deal with the little resources. The big population will have to deal with the resources based on the population. Enough in developed and developing countries, you find this kind of surge more. And that's why if you check the developing countries like China, for example, now, they have some laws that they've put in place within their country to check the surging population. So they make it mandatory that every family must have so number of children, don't exceed this particular. So there was a time even Nigeria was trying to consider that, because imagine in the last 5 years, we were less than 180 million. We're 2023 now, we're almost hitting 220, if not more, like that. So you see that the population is surging. But do we have the kind of health facilities, enough health facilities, and a suitable environment to manage the health of this surging population? So that also becomes a serious problem based on the rapid increase in the population change of countries. And you find most of this, or more of this, like I said, in developed and underdeveloped countries. So those are some of the factors or the challenges facing health promotion in places like Nigeria and the rest developing and underdeveloped countries. All right. So let's look at a new topic: quality of life. Quality of life, QOL. When we say quality of life, we're talking about the measurement of your well-being. That's basically the quality of life. So if I ask what's the quality of life, I'm interested in the individual's position about life. How much do you want to live well? What are your goals? What are your expectations? What are your standards as far as your health or the quality of life that I want to live is concerned? So World Health Organization defines quality of life as individual's perception of position in life in relation to his goals, expectations, standards, and concerns. So quality of life deals with living a normal life. You're living a normal life. Your normal life should bring you happiness and not depression, not anxiety, not sadness, not sorrow. And when you're happy, when you're living a normal life and you're happy, you're able to think well, you're able to come up with goals and achieve them. At the end of the day, you satisfy yourself. There's this personal satisfaction you have, and also your surroundings. So that's basically what quality of life is. So when we talk about quality of life, there are 4 major things or 5 major keys that determines the quality of life of an individual. Number 1 is his normal life. Is he living a normal, healthy life? Number 2, is he living happily? Does he feel happy with the life that he has? Or does he feel an urge to commit suicide? So is he happy with the life that he's living? Is he achieving his goals? And is it attaining personal satisfaction for himself and also for the people around him? So basically, quality of life, like we said, is a sense of well-being. sense of well-being. And this quality of life is measured by your physical, your mental, your emotional, your psychological, your social, and even your spiritual well-being. So why do we need to measure quality of life? Why is it important to measure quality of life? Number one, because it helps to evaluate the effect of health services on citizens' life. So the higher the score of quality of life, the better is the promotion services. Okay, so that's number one reason why we need to measure quality of life. Number two, to classify health hazards according to their effects in quality of life. So when we measure the quality of life of the people within a given geopolitical zone or a region, it helps us understand the health challenges or health hazards that they are facing. So when they are not living a normal life, they are not happy, they are not attaining satisfaction, they're not in that state of well-being. It means there's something inherent or there's something within the environment that is causing that individual not to have a good quality of life. All right, so it's also help us to evaluate the effect of different lines of treatment on patients. So when you understand what somebody is suffering from based on the low quality of life that this person is living, it will help us know the kind of treatment, the line of treatment we're going to give the person to actually improve that score. It also helps us to evaluate the rehabilitation methods used by handicapped. You know, somebody who is an amputee has right to quality of life. He should not feel inferior or feel like he's a second-class citizen because he doesn't have two legs. So quality of life is where, orthopedic doctors and the rest of them begins to develop prosthetics, and then they act. So you see all these people, they begin to build prosthetics, attach it to the amputated leg, and they are able to live their normal life, walk around and do everything like every other citizen can do. So it's part of quality of life. So it helps us to evaluate the rehabilitation methods used by handicapped, just to make sure that a cancer patient has a right to quality of life despite her cancerous nature or cancerous life. Like I said, an amputee has right to quality of life. A blind person has right to quality of life. So all of these things can help us. When we measure all of these things, it helps us know the kind of rehabilitation they have to do. So how do you assess quality of life? Number one, by using questionnaire. Questionnaire is a set of written questions distributed to respondents just to get answers to some certain questions. So we can use questionnaires to assess quality of life of people. So you consider their physical aspects. All right? Physical aspects, their heights, their weights, and all those stuff like that. We'll consider psychological aspects. Okay? We'll consider the spiritual aspects, consider the social aspect, and also the environmental aspect. So when you're using questionnaire to assess quality of life, the questions that need to be asked or the areas that need to be evaluated in the questionnaire include all of these physical aspects. You look at them from head to toe. Are they okay physically? Are they blind? Are they having burns? Is there any disease or sickness that is noticeable with the eyes? That's the physical aspect that we're talking about. The psychological aspect has to do with their thinking faculty, mental state, more or less like their mental state. Then their spiritual aspects, their relationship with whatever they believe in. Okay, those things is helping their quality of life. Social aspect, how they interact with the environment, with the people around the environment. It can be their colleagues in the office, neighbors in their compounds, co-students in their class, with the teachers and the rest of that social aspect. And of course, the environmental aspect, how you relate to the nature and the things found in your surrounding. So those are some of the things that needs to be evaluated as far as assessing quality of life using questionnaire is concerned. Global burden of disease, using certain indicators for us to know the global burden that is facing the world, or the disease burden facing the world, we use some certain indicators such as the CALI, which is called the Quality Adjusted Life Years. We have the Disability Adjusted Life Years. We have years of life lost, and then you have years lost due to disability. Many countries have records of all of this within their country. So if local governments down to states and then down to a country will be able to know how much burden of a disease the world is currently facing. And that's why you can see some statistics given by World Health Organization. They'll tell you that 94 million persons are living with so. They'll tell you that African population is almost 1 billion. Out of that, more than 72 or 75% of Africans are living below $1. That means the rate of poverty in Africa is almost 70 something. So why are they able to get all of these statistics? Because there's an indicator, okay, that is used to actually measure all of these things country by country. So within a country, it can be taken from the area of hospitals down to local government. So local government goes to the health workers in the local government, goes to all the hospitals within the local government to take statistics of all of these things using these indicators. Then they put it together. State comes, takes it from the local government, put it together. The federal government comes, take it together like that. So that's how we're able to now know how much burden the world is facing as far as disease is concerned. But those are some of the indicators that is actually used. All right, so that's quality of life. Why there's need to measure quality of life. We looked at the indicators that can also be used. Is defined as a planned opportunities for people to learn about health and make changes in their behavior. So when they learn about their health, it will help them to make changes in their behavior. And it's responsibility of everyone, especially the healthcare providers, both at the community level to the metropolitan level, down to the states, to the local, to the nation as a whole. So when you call people who smoke to tell them about the dangers of smoking, you see that when they now have an idea of the danger of that smoking, many of them, even if it's not all of them, many of them can now begin to make some kind of adjustments to stop that smoking, because they understand the effect it has on their vital organs of the body. So health education is about letting them be aware of what they face as far as health is concerned, and that can also help them make changes to the things that they do. So there are basically different steps to health education. Number one is to know. So the steps, number one is to know, that is knowledge. Number two is to feel importance to health, that is attitude. And number three is to change. So health education does those three things. Number one, to know. You've given them the knowledge. Number two is to feel remorse about what they are doing. That is the attitude. Number three is now the practice. They begin to now change. I feel bad. I will stop smoking from today. They already feel remorse from the knowledge that they have gained. And then they now take away everything, their lighters, their matches, and stuff like that. So those are the three steps as far as health education is concerned. Number one, like I said, knowledge. Number two is attitude. Then number three is the practical, where they begin to change. So we're in the era of health education, where health education helps us to improve quality of life. It helps us to restore the state of good health, not just in an individual, but a community or a population at large. It helps us to make the best decisions of remaining healthy. That is constantly being in doing things that will promote our health, prevent diseases and hazards, control of these diseases, and even the complications, and of course rehabilitations. So health education helps us do all of these things, and that's the era where we are, and everybody must play a role as far as all of these things is concerned. So health education can help us improve the quality of life that we're living, restore our health, and then give us the best practices as far as our health is concerned. All right. So who are responsible for health education? Number one, we have the source or the educator, who happens to be the doctor, the nurses, the health workers. You can also get this health education from televisions, where they do some kind of health tips or health programs, and every week they pick up a topic to just educate the people about it. Then you can read from books. You can also learn from films. There are some films that have really learned a lot as far as my health is concerned. Grey's Anatomy, The Good Doctor, nurses, interns. These are some medical this thing that really helps to educate people. Then we also have different channels. That's method of actually giving this health education. We have face-to-face. Then the receiver is actually the audience, the targeted audience. And when you're giving health education, make sure there is no barrier to things that can actually not make people get to understand it. So these factors can actually decrease the response when you're educating them. So make sure there's no barrier. One of the barrier basically is noise. So make sure that noise is eliminated within that particular vicinity. So the source are the medical personnel and the media houses and journals and books and movies and films like that. Then we have a targeted audience, which is the people they're actually trying to talk to, and then make sure that the barriers are eliminated so that they can actually understand it. So health education program, what is the message? That's number one. What is the message? Who will give it? Who is our target? How will it be given? Where will it be given? When and how frequent will this be given? And then, of course, at the end of the day, okay, so what is the message? That's number one. So we're looking at them one after the other. What is the message? Let's say maybe you want to talk about environmental sanitation, how to keep your surroundings clean to avoid mosquito breeding sites. All right, that's the message for the week. Who will give it? We need to identify who will give it. The health officials or the community workers, community health workers, and the rest of them. Who are the targeted audience? A particular community. You choose a particular community at a point in time to do this. How will it be given? Are you going to call them are you going to call a town hall meeting, or you're going to do a town crier kind of from where somebody goes around and just talking about it, or you organize a seminar? How? That's how will you give you? Where? Okay, it's also another one. Then when? How often? Is it every 3 months or just one? I remember during my service here, we did a whole lot of this as core members, having to just go from schools. Our target audience were the secondary school students. We go from one school to the other, trying to tell them about HIV and AIDS and the rest of them. So that's health education, is all encompassing. All right. Then there's also need for community participation. If communities don't participate in health education, it will not be a success. Remember that this health education is actually more for those living in the rural, in the interior parts of the country. They're the ones that need this education more, because somebody who is living in an urban area he has access, whether he likes it or not, he has access to health education. So when he owns his television, he has no choice than to see it. When he opens his phone to look at Facebook, he must come across something. He goes to school, he hears it. So the target is actually the community, and there's a need that community must also be part of it. All right. So that's community participation. Okay. So in community participation, how involve representatives in planning and execution team. So when you're going to a community to give a health talk, involve the community. Look for 1, 2, 3, 4 persons who is enlightened and make them part of the team, because when they see that the persons are involved in it, it's easy for them to actually embrace or to accept the message they're coming to deliver. Population needs must be assessed in health planning. So who are your targeted audience? How many are they? You look at the population. If they are much, are we going to split them into different groups? Then group 1 will be talks to by this person. Group 2, we're going to do it, so I understand the population size of the people within that community so that I can have proper planning. Then help people to get knowledge, skills, information, and fund, and then enable our population sectors to represent themselves. So those are some of the things in community participation, how you can do that. All right. So the next is behavioral science, how people think in health and disease is also part of health promotion and education. It helps to also improve doctor-patient relationship. It helps to solve health problems easily. And when it comes to behavioral science, understand that people reason or accept issues that has to do with health differently. And most of these are usually influenced either by their culture or by their religion, their belief, their background, and so many things that they've exposed themselves to. So all of these things, so you find people reacting differently as far as health matters or health issues is concerned. Therefore, I'll tell you that they don't like piercing in their system, and there's nothing I'm going to tell them that make injection go through them and stuff like that. So there's a whole lot as far as it's okay. So health belief model, individuals perceive risk, its severity, their susceptibility, and the rest of that. This one talks about the various models of people's belief as far as health is concerned. Some don't see it as anything, some see it as a very serious thing. Some persons' headache is nothing to them, it's normal life. But some, when they have headache, is a problem, the whole world must know. I've seen a situation where ordinary headache killed somebody. A whole situation where headache is nothing for some persons. So it depends on how people actually embrace this. All right. Yeah, so that's a health belief model. It talks about motivation. So we have personnel, both internal and external. How do they perceive disease severity? Some see it as a very serious issue that needs action, and then some don't see it as anything. Others, when they see that action is needed, they go for a checkup, they go for treatment, but they fail to go for checkup, and before you know it, they will have what we call a relapse. So these are just different models. That diagram you've seen just tells us different behavioral models of people as far as health is concerned. All right. So that's that for that. Then behavior in illness. They are talking about how also people perceive diseases or illness. Where some persons have disease, you have people who don't do anything. So that's one group of people. They are sick or they have a disease, they just stay, they don't do anything. That's category of number 1. And those who don't do anything, last, when they have a problem, they now go for self-treatment. Okay, let me just take it like this. Let me give you different how people behave in illness or when they have disease. You have those who don't do anything. That's number 1. Number 2, category of people is those who take self-treatment. They prescribe drug themselves without consulting anybody. You have the third set of people who run to the doctor for help. Then you have some who, even when they meet the doctor, they don't adhere to doctor's prescriptions, to what doctor said they should do. And there are some who follow that treatment the way doctor said it to the last. These are, just examine yourself, which area do you fall into as far as your behavior towards illness is concerned. So most times you see that arrow is showing that for those who don't do nothing, when the sickness refuse to leave them because they decide to do nothing, they will try self-treatment. So from do nothing, they proceed to self-treatment. It's after when they now say that the self-treatment is not working before they go to the doctor. And when they now get to the doctor before they get their treatment. Some can be lucky when they follow this path like that, they come back to normal. But there are some that will not be lucky. They have a disease, they don't do nothing, they die because they didn't do anything. You have some, they don't do nothing, and then when they realize that they need a problem, they now take to self-treatment. They take the wrong drug, they die through that process. Then there are some that they don't do nothing. When it deteriorates, they take to self-treatment. They discover that the self-treatment is not working. They go to the doctor. But by the time they are approaching the doctor tells them, it's late already. I wish you had come 2 weeks or 3 weeks before now. Something would have done. They die. And then you have the ones who, doctor will now, prescribe treatment and everything, just like we said. At the end of the day, because it's already too late, they still die. So these are different behaviors of people towards illness. So the best thing for you to have a good health or quality of life or health promotion, the moment you notice a symptom, please go and meet a doctor. Even they always tell you, if symptom persists after 3 days, consult your doctor. There's a need. There's a reason why they say consult your doctor if sickness persists or symptom persists after 3 days. So it's very, very important that we also take note of that. So these are different behaviors of people towards that. Factors affecting illness behavior: severe, prolonged, or frequent symptoms. We have unusual symptoms. We have personal tolerance to symptoms. We have culture and knowledge about symptoms. We have stigma of disease. We have doctor-patient relationship. We have availability of reliable health service. These are factors affecting illness behavior. So sometimes because they feel it's a chronic disease, they've already agreed that this is there's nothing I can do about it. It's going to live with me for the rest of my life. So it's not just stay like that. Any day they want to die, they should die. Because they identify that the disease is so severe or it's so serious or they're going to live with it for the rest of their life. So they just say, don't need, if I'm going to live with it for the rest of my life, then why not take care of myself? That's one of the factors I'm talking about. Unusual symptom. Today is headache. Tomorrow headache will go. Tomorrow is this one. So before you know it, it comes and goes like that. The symptom is unusual. They just feel, okay, it's normal. It's another factor. Personal tolerance to symptoms. There are some Africa, they kill Africa. All this kind of thing. Don't worry, when I sleep, it will be okay. When I take a bow, it will be okay. All of these are people's personal tolerance to symptoms. Culture and knowledge about symptoms. Like we said, culture forbids piercing. Our religion forbids donating blood or receiving blood from people. Culture plays a role in how people behave towards illness. Doctor-patient relationship. Their doctors are not good. Nurses are very annoying. If you get there, they'll just be shouting for you up and down, be doing that. If people just sit in their house, it's another factor affecting illness or behavior. I know they go to that hospital. They are very annoying people. What concerns you whether they're annoying or not? So are you not going there for just your health, for health reasons? But that's a factor. Availability of reliable health services. At that hospital, they don't have anything. You go there and they will still refer you to Benin. I don't have money to go to Benin. It's also another factor. And then cost of the service. They tell you, to just treat ordinary malaria and typhoid, they're charging you to the 3,000. Where do I have the money? I better just go and drink bitter leaf and then send leaf and I'll be okay. So these are some of the factors affecting illness behavior of people. So you see, there's a whole lot to all of these things that we're saying. So it's very, very important that we understand all of these things. Then communication is vital as far as health promotion, health education is concerned. We must always communicate to people, let them know, especially the health providers and the rest of them. All right. So communication is very, very key, and the different methods of communications, right, that we can use. But understand that your communication must be simple, it must be elaborate. When you're communicating, make sure that people are listening to what you're saying, to be sure that what you're saying is actually being gotten, and also expect a feedback. The different methods of communication, we have the verbal, we have the non-verbal, we have the body movements, we have the facial expressions, we have the touch, the shake, the hands, we have the personal appearance, and we have the voice interference. All of these are different methods of communicating health, and when you're carrying out health education, these are various things. Barriers to communication, can be environmental, can be pathological, can be language, It can be personal, like values and beliefs and experience. It can be psychological, stress, anger, and the rest of them. These are some of the barriers to communication. Your environment can limit, all right, the distance, the access to the environment, the nature of the environment. It can be not, the environment may not be conducive for people. Those are those things. Pathological, you're scared of being exposed to pathogens and illnesses. It becomes a problem. Language barrier. I don't understand Yoruba. How do I communicate to people who don't understand English? Then people's beliefs and the rest of them can also affect. And of course, psychological. All of these are barriers to communication. We must find a way to deal with that. Okay, so finally, that's exactly what we have today. I hope you enjoyed today's class. And that's all about health promotion. And I'm sure that we're not just going to be, hearers of everything we've discussed in this class, but we'll practice it and be able to do the same, like spread this, be a health educator or a health ambassador in trying to improve, promote, and maintain health in our spheres or anywhere we find ourselves. All right, thank you very much for joining me for today's class. I'll see you some other time. Have a beautiful day.